Hello, everyone, and thank you for joining the This is Public Health Graduate School Mini Virtual Fair. We ask that as you join, you turn off your cameras, and we're going to keep the cameras on for just our presenters. And please make sure to mute yourself. We'd really appreciate that. Throughout the presentation, you can ask questions in the chat. Please try to keep your questions for the initial part of the presentation as general as possible, and save your specific questions for the breakout rooms. And for visuals, if you want to just see for people who have their videos on, you can update that by going to hide non-video participants, and also go to speaker view. Here are our presenters today: Boston University, University of North Texas, George Washington University, St. Catherine University, Stony Brook University, the University of Texas Health Science Center at Houston, and Yale. We really look forward to all of the presentations, and we welcome our first one, Boston University.
Thank you. Greetings, everyone from Boston. I'm going to go ahead and share my screen. Give me 1 second while I pull that up. Awesome. So today I'm going to just give you a brief overview. I promise to give you more in-depth information if you decide to join the breakout room, but today will just be very quick and touching on a few things. So why Boston University? So we are ranked the top 8 best graduate school for public health in the US by US News and World Report. In addition to that, we are located in a fantastic location where Boston is really the mecca for public health, for healthcare, and for education. So if that's something you're interested in, Boston has a lot to offer in that area. Furthermore, we are a research university overall, so there's ample opportunities to engage in research as well, in addition to in the school and at Boston University and the vicinity of the university as well. We also have a fantastic graduate student life, career, and practicum office to help you navigate what's next after this degree. It is a lifetime service that we offer, and so even after you graduate, you can always come back for these resources. And you also have our great alumni network as well. So these are just a few points of why Boston University. Another thing that is very important to assist diversity and inclusion. Diversity and inclusion is really central to everything that we do as a school. Our mission statement is even rooted in social justice. We have a variety of different programs and a variety of different community activities and engagement activities to really make sure we are holding D&I at the forefront of everything we do as a school. And if you want to learn more, happy to touch more upon that. Here at BUSPH, we offer a variety of different graduate programs for public health, including our most popular one, which is our Master of Public Health program. Within that program, we also have dual degree programs incorporated in that. Again, happy to share more about that as well. We also have our Master of Science programs, which are research focused. We have a Master of Science in Applied Biostatistics. We also have our Population Health Research umbrella, which encompass 5 additional MS programs, including an MS in Epidemiology and an MS in Public Health Data Science as well. We also offer doctoral programs, and these programs are very competitive. And the great news about all our programs that you see here on the screen is that we do not require the GRE for any of the programs, including our doctoral program, which is something we're very proud of and very excited to announce, because it really eliminates barriers for the program. So I'm just going to skip this slide here. I'm going to keep it very general. Another great thing about our MPH program and our programs is that what makes us unique is we offer a variety of different concentrations for our students to specialize in. So not only are you coming out with an MPH, but you are coming out with specific context areas that you want to specialize in. As you can see here, we offer 16 different areas, which is a very large variety, which you don't really see across other graduate programs. And so this is just an example of the different things you can decide to study: healthcare management, environmental health, and so on and so forth. We even have, I'm going to switch over here, mental health and substance use, maternal and child health, human rights and social justice. And so we offer a wide array of different programs and different options for you to tailor your education to what you're passionate about. And with that, I'll pass it over to University of North Texas.
Awesome, thanks so much. Let me go ahead and share my screen so that we can talk a little bit about UNT Health Science Center and the programs that we offer here in the School of Public Health. So the UNT Health Science Center, located in Fort Worth, Texas, is an institution that has been around for about 50 years, but specifically the School of Public Health has been just around for over 20 years now. Within the School of Public Health, since its establishment in 1999, the school has grown to offer a variety of programs that are both offered in a face-to-face setting through our cohort model, as well as our online programs. Currently, we offer the Master of Public Health, again, both on campus and online, but specifically with the cohort on campus program, we offer 4 different areas of concentration. In addition to the Master of Public Health degree, we also offer a Master of Health Administration that's housed in our School of Public Health, both an on-campus and online program, as well as the Master of Science and PhD program, which also offers 2 areas of concentration, both the same for the Master of Science and PhD, and those are epidemiology and health behavior research. Our programs, again, are basically sorted into 2 different categories: our on-campus programs, which are cohort model programs, and our online programs, which are 100% online asynchronous programs that are formatted in 8-week terms. Our more research-focused programs, which are the Master of Science in Public Health Sciences and the PhD in Public Health Sciences, both are based on campus and have the same 2 areas of concentration, which again are epidemiology and health behavior research. With our cohort model program, those 4 areas of concentration include epidemiology as well, but also biostatistics, maternal and child health, and then our more generalist track that we refer to as public health leadership. Our on-campus student population is essentially composed of individuals that have an average age of about 22 or 23 years old. They are individuals that tend to come right out of undergrad and go right into their grad program and continue their education and focusing on their Master of Public Health or their MHA or their MS or PhD and so on and so forth. Our students also come from a variety of different disciplines, coming from over 26 to now 30 in this most recent new class that entered now 30 different majors. And of course, this comes from a variety of different universities. A good thing to point out about our on-campus cohort program is that about 65% of our students in our on-campus program receive one of our 3 different levels of scholarship as well. Our more research-focused programs, the MS and PhD in Public Health Sciences, definitely emphasize a focus on targeted research and interaction with our SPH faculty. Our Master of Science degree is essentially a preceding program that our school highly recommends that those students that are interested in a career in research, of course, within epidemiology or health behavior research, that they look into. And our doctorate program, our PhD in Public Health Sciences, which comes with 4 years of funding, although it is a 3 to 5, can be a 3 to 5 year program completion time length. The PhD in Public Health Sciences offers 4 years of funding, which a current living stipend that has increased, we're proud to say this year, to $30,000 annually. During the MS and PhD, your time in the MS and PhD program, students are working closely with our SPH faculty, conducting their research, helping them with their research projects, as well as grant-funded studies as well. And those studies and research projects come from a variety of different areas, as we have a variety of faculty that are working within public health, but they may have been trained in different educational or come with different educational backgrounds, such as mathematicians or statisticians or biostatisticians, some social science faculty, trained faculty, sociologists, and etc. And lastly, I would like to also mention that our School of Public Health at the UNT Health Science Center has a total estimated cost of on-campus students of about $13,000 for the entire 2 years of the duration of the MPH program. And that quickly sums up our program here at the UTHealth Science Center. We'll now turn it over to the George Washington School of Public Health.
It's not boasted about killing nearly 1,000 people. How would they most come?
We have a participant here who, oh, I think they muted themselves. Sorry that interrupted you, Brandon. So my name is Trisha Rilbuto. I am the Assistant Director of Admissions for the Milken Institute School of Health. Brandon, I believe I need you to stop sharing your screen so I can share mine.
Sure. As soon as I get my computer to respond, and there we go.
Always the case, right?
Right.
Wonderful. Like I said, my name is Trisha Rilbuto. I'm the Assistant Director of Admissions for the Milken Institute School of Public Health. And so this is our beautiful building. We're located in the heart of Washington, D.C. We are the only school of public health in Washington, D.C., as well as the largest school of public health in the country. Within our school, we have 7 academic departments: biostatistics and bioinformatics, environmental and occupational health, epidemiology, exercise and nutrition sciences, global health, health policy and management, and prevention and community health. So I'm not going to read through all of these for you, but I just wanted to share this is a list of all of our programs. So we have 15 different concentrations for our MPH program. And what I love about our MPH programs is that all of the MPH programs, you're taking the same core courses. So you're taking a health policy course, an epidemiology course. So everybody's getting some of those same foundational courses. We also offer some MS programs. We do offer an MHA program, a Master of Health Administration, and we are one of the few MHA programs in the country that still offers a third-year fellowship program. We also offer some PhD programs and a DRPH program. We do have an online MPH program and an online MHA program. I will say for the online MPH program that it is a more generalized program. So if you are interested in any of our concentrations for the MPH, that you would need to be an in-person or residential student. All of our classes are offered in the afternoon and evening. And so if you are interested in working part-time or full-time, that we are able to make sure that you are still able to do that. And then for all of our residential students, you are able to take up to 15 credits online as part of your 45 credit MPH program. So I'll talk briefly about our application requirements. Like all of my colleagues here, you'll apply to their schools through SOFIS, and all your transcripts and documents sent directly to SOFIS. For this upcoming year, the GRE is only required for our master's in epidemiology and our PhD programs. So any of our MPH programs, the GRE is not required for this year. We do need 3 letters of recommendation, a statement of purpose, a resume, and then an interview if you're looking at any of our doctoral programs or the MHA program. And then any of our international applicants will need a transcript evaluation, West preferred, and then language proficiency scores as well. So our application deadline has passed for the spring, but for interested in starting next fall, our doctoral and master's priority scholarship deadline is December 1st, and March 15th is our final application deadline. I know I'm almost out of time here, but I just wanted to share for our 2021 cohort profile. We did have our largest incoming class that we've had. So 55 MHA students, 283 MPH students, and 21 MS students. And then contact us. So we are offering small in-person information sessions. We're also available via Zoom or the phone, and then offering a wide variety of virtual larger events. And I'll be able to share lots more information during the question and answer session. So I'm going to stop sharing my screen and send it next to St. Catherine University Public Health Program.
Thank you. Once again, my name is Elle Freeman, and I'm here representing St. Catherine University. So our program at St. Catherine University is a Master's of Public Health in Global Health. And what we mean by that is that our global health is not just a concentration. Global health is embedded within every portion of the curriculum of our program. So we are located once again in St. Paul, Minnesota, which is extremely important because our program is a hybrid program, meaning that our program meets on campus alternating weeks. We do have some on 100% online courses within the program. Those are typically elective credits. So you can complete our program in 2 or 3 years. Typically, students who are taking the 2-year track are taking 3 classes each semester. If you're completing the 3-year track, you're taking 2 classes each semester. And that's not something that you have to indicate at the point of applying to the program. So if you're not sure what your fall will look like next year, there's plenty of time to decide to be a student, especially and still work full-time as an adult. Our program is 44 credits and we admit 35 students each year. And we have one cost for international, in-state, and out-of-state students at $859 per credit. So we do have up to $10,000 of funding available via scholarship for diversity, alumni, and academic achievement, as well as a global health mission scholarship, which you can apply for by answering a question on your SOFIS application. Also, if you work for one of St. Kate's corporate or community partners, you can be eligible for up to 10% off of your tuition. And we're always willing to speak to leadership or HR representatives from corporations to expand our corporate and community partner list. So our applications are currently open now for fall of 2022, and we only admit in the fall. And if you want to be fully eligible for all of the scholarship opportunities, you would want to complete the priority deadline by March 1st. If we have space in the program, then our application will remain open through June 1st. To be eligible for our program, you do need a completed bachelor's degree or graduate degree from a regionally accredited institution, or your WES evaluation saying that you have the equivalent of a US bachelor's or graduate degree, as well as a cumulative GPA of 3.0 or higher on a 4.0 scale. If you do not have a 3.0 or higher, we would accept a GPA statement, just explaining what issues you faced and what you've done now to be prepared for a graduate level program. We do not require the GRE. So we also have 2 prerequisites, a statistics as well as a health-related science course. And to learn more about the program, I really do suggest that you join us tomorrow, Wednesday, October 6th at noon Central Daylight Time to really hear about the program from the faculty perspective. It's one of the best ways to learn about who we are as an institution. And now I'd like to welcome Stony Brook.
Great, thank you so much. I'll start sharing my screen. Hi, everyone. I'm Joni Maniaci from the Program in Public Health at Stony Brook University. And we are located out on Long Island in New York. We're about 60 miles from New York City. I'm going to tell you a little bit about our MPH program today, but we do have several programs within the Program in Public Health, which we're happy to share with you in the breakout room or separately afterwards. After today, you can connect with us about any of the programs that we offer. A little bit about Stony Brook. As I said, it's out on Long Island. It has over 26,000 students enrolled at Stony Brook, but our MPH program is really small and intimate, which is one of my favorite parts about working for the MPH program here, is because it's part of a large entity at Stony Brook. We have a school of medicine, a school of dental medicine, a school of social welfare, a school of nursing. And we obviously also have the College of Business and Engineering, and all these programs makes for a really great and learning environment for our public health students, because public health is everywhere and it's interdisciplinary by nature. And we have such a great place for our students to learn. And we have several dual degree programs, which I'll show you as well. PPH is one program with several different degrees. So while we're not a school of public health, we're not just an MPH program. We have a lot of different offerings. We have a Master's of Health Administration, which is fully online. We have an MPH with a variety of dual degrees, including an MBA, public policy, nutrition, social work, MD, and then we have a concurrent program with our dental school. Beyond that, we also have a PhD program, and we have an MS in epi and clinical outcomes. So again, we can talk about any of these in our breakout room, or if you want to connect with us after today. But this presentation is a little bit more involved on the MPH program, which is a 54 credit program. It is on site. It's completed in the evening. We have full-time and part-time options. We have 3 concentrations, and we have, as most any CEF accredited MPH program, we have our culminating experience, which for us is a practicum and capstone. Our practicum is one of our highlights of our program. We have a practicum and community engagement coordinator here on staff that works with our students to find opportunities. Several of our students find opportunities right through our faculty, whether that maybe starts out as an internship and develops into a practicum, or using the community network that our faculty have. We engage with our community partners to find students fantastic experiences. That's typically done in the second year of the program. Again, part-time option is available. Students can complete the program in 2 years, and they get a maximum of 5 years. Classes are at night, 5:30, which allows for students to work during the day and come to us in the evening, and why some of our dual degree programs are even an option, because you can be in medical school during the day here at Stony Brook, and then come right down one floor, one flight of stairs to our MPH classes, are all in the same building, which is great for our dual degree programs. A little bit more about our program. We have the 3 concentrations. We are very excited about our community health concentration. We work with the Aldous Center for Communicating Science on our health communications course. So for anybody who's old enough to know who Alan Alda is, we have a center here at Stony Brook named after him. He started it, and they have a health communications certificate, and we work with them on this concentration, in addition to our community health foundational courses in evaluating, planning, and implementing community health programs. We also have our concentration in health analytics just recently changed, and I realized that the slide is different on the first one than this. It's epi and biostats now. We just revisioned this, reworked it, retooled it with our faculty, and now it's much more involved in terms of epidemiology. So we're happy to launch that this fall. Health policy and management is our 3rd track. This is asterisk because it's also accredited by the Commission on the Accreditation of Healthcare Education Management, CAMI. So if you're looking at MHA programs, you're looking at MPH programs, something like this might be a nice place to fall in between. You're interested in population thinking, but you also want to think about working maybe in a healthcare setting or for a health system. And you can see those courses on this slide. As with all the other programs, we participate with SOFAS, and our deadline is a little bit later. It's June 1st. We start reviewing and begin offering seats in January. We require several of the same things that you've already heard today: essay, letters, the bachelor's degree, all of those things that are provided for you right through SOFAS. I will note that our essay is very specific to our institution. That's one pointer I'll give to everyone on the call today. Make sure you read the prompts from your individual schools when you're writing your essay. Not every institution is looking for a generic essay, and we have a very specific topic that you should read before you write this response. Here's another big benefit of Stony Brook. If you are located in New York, if you're a New York State resident, it's kind of hard to beat the tuition for our MPH program. $471 per credit is the current tuition rate for New York State residents. So if you're on the call and you're from New York, or you're a New York State resident, then definitely join us in our breakout room. We'd be happy to chat with you. We do have non-residents, international students come to our program too, because Stony Brook is well-founded in a lot of different things, and Stony Brook is world renowned. We have international students, we have students from across the country, but predominantly we have New York State residents in our MPH program. So happy to chat with any of you. Contact information, and that's it for my presentation. But thank you so much for joining us today. And now I'm going to turn it over to UT Health Sciences at Houston with Ellis.
Thank you. All right, let's try to share my screen. Okay, can you guys see this okay? Yes?
We can see it, yeah. Elvis.
Okay, perfect, thank you. All right, good morning, good afternoon, good evening, depending where you're joining us from. My name is Elvis Parada. I'm the Assistant Director of Admissions and Student Services for the University of Texas Health Science Center at Houston, UTHealth School of Public Health. Our vision is health without boundaries, and we believe that we can achieve this vision. Yeah.
We can't see your presentation.
Oh, great. All right, give me a second. Can you see it now?
Yep.
All right, thank
Looks
you.
good. Yep.
All right. So our vision is health without boundaries, and our mission is changing the culture of health through excellence in graduate education, research, and engagement. As you can see, we do have 6 campuses across the great state of Texas. Houston is the main campus located in the Texas Medical Center, but we do have campuses in Dallas, Austin, San Antonio, Brownsville, and El Paso. And we do have 2 time zones because El Paso is in Mountain Time. We have celebrated over 50 years. We are the first school of public health in Texas. As I mentioned, we do have 6 campuses across the great state of Texas, and we have experience in working with communities across the state, the nation, and the world. We do have 16 research centers that we work closely with, and we are CEEP and SACS accredited, and our healthcare management program is CAMI accredited as well. We have 4 different departments. We have a biostatistics and data science where we offer an MS and a PhD program. We offer an epidemiology, human genetics, and environmental science, MPH and PhD. Health promotion and behavioral science, we offer an MPH, PhD, and DRPH. And then the management, policy, and community health, we offer programs in MPH, PhD, and DRPH. We have 17 graduate non-degree seeking certificates, 17 graduate degree seeking certificates that you can add on top of your degree seeking program, and we have about 18 dual degree programs and 9 accelerated master's programs. This kind of gives you an idea of what we offer. The MS and biostatistics, you can see the wide variety of the MPH programs, and epidemiology, health promotion, customized dietetic internship program if you're interested in that area, and then the PhD and the DRPH programs. And we can talk a little bit more in depth in our breakout sessions. This is a list of all 18 dual degree programs. As you can see, we do offer a wider variety in almost different areas: DDS MPH, MD MPH, MSW MPH, PharmD MPH. And this is in conjunction with these partnership institutions where we share credit hours and you complete both degrees in a short amount of time. We do offer several graduate certificates and non-degree seeking certificates, and this is a list of all the ones that we do offer in data science, general public health law, research, and policy surveillance. And so this is just a wide variety of non-degree or degree seeking certificates that you can add on to your degree. Our program modalities, all of our programs are offered face-to-face or what we consider hybrid, because you can take some classes online and the majority of your courses face-to-face, but we do offer 3 fully online 100% MPH programs in epidemiology, healthcare management, and health promotion and behavioral science. Be aware that the healthcare management is a cohort style program and you must be already employed in the healthcare field, and so they have very specific requirements in that end. And then we offer a variety of our certificates that are face-to-face, hybrid, or fully 100% online. Our application deadline, our spring just closed, and now we're accepting applications for fall 2022. Our priority scholarship deadline is December the 1st, and our final deadline is April 1st. And then those are the non-degree certificate applications deadlines that we accept 3 times a year. Our tuition and costs, we are one of the lowest among the schools of public health. Per credit hour for in-resident tuition, we're looking at $272 per credit hour, and then non-resident, it's $1,051. So we are among the lowest tuition and fees of accredited schools of public health in the country. Scholarships, we do offer several new student scholarships, and they're automatically considered when a student submits their application via SOFAs. We do have several GA, GRA, TA positions that may be available to our incoming degree-seeking students. One thing is worth mentioning: being awarded a new student scholarship of $1,000 or more, or a GA, GRA, TA position meeting specific requirements within UTHealth may make the student eligible for in-state resident tuition. So that's something that's really great for our out-of-state or international students. This kind of highlights all the different requirements similar to other schools. Definitely, I agree with Stony Brook. Please review their websites for each individual institution. 3 letters recommendation, a West transcript evaluation if needed, or all official transcripts directly to SOFAs. Our GRE, MCAT, and GMAT scores are currently optional for this year. Why School of Public Health? We provide a world-class education. We're a cost-efficient program. We're among the top 25 schools of public health, according to U.S. News and World Report. We have a diverse student population, and we're 13th in federal research funding among schools of public health. This is my contact information, our admissions office contact information. You can always reach out to Ms. Natalie Guardado as well. She works closely with me. You can always follow us on social media, either LinkedIn, Facebook, Twitter, or Instagram to see what we have going on across the school as well. And that's all for me. At this time, I will pass it over to Mary with the Yale School of Public Health. Stop sharing.
Hi, everyone. Thank you for joining us this afternoon. I'm looking at the time zone in different places, so thanks for putting up with my hesitation there. My name is Mary Keefe. I am the director of the MPH program at the Yale School of Public Health. I'm going to share my screen. Let's hope it works well. And I hope, I know this is a lot of information for all of you to gather in this sort of brief presentation, but we hope that what this will do is encourage you to start to reach out to some of us if you have questions as you go through this process, but also to understand that while we are all looking for very similar types of passionate, committed students looking to do great work with their degrees in public health, we're very different institutions. And so for you as the applicant as the admitted student, you're going to have some big decisions to make. And so let me just tell you a little bit of background about the Yale School of Public Health. For those of you that don't know, we're located in New Haven, Connecticut. The Yale School of Public Health was established in 1915 as a department in the Yale School of Medicine. So we've been around a while. And we like to think that the model that we use now works very well for us and for our students and our alumni. We basically offer 3 different degrees. While I am most familiar with the MPH and the admissions process for that, I'm happy to put any of you in touch with the directors of the MS and PhD programs, should that be what you're mainly interested in. Our MPH takes a couple of different formats. For most of our students, the program is 2 years. And the 2-year program is, as it says on our slide here, open to people without paid professional work experience. So students coming directly from their undergraduate institutions are well situated and suited for our 2-year MPH program. And although we don't require paid professional work experience, we do require some type of background, exposure, experience in health or public health that is now informing your decision to apply for your MPH. And I'll get into that in a minute about where we look for that. So the 2-year MPH is offered in several different academic departments, which is sort of what you've heard from a lot of the schools already. Biostatistics, we break the epidemiology tracks into chronic disease or microbial diseases. You can also have a background applied to environmental health sciences. We have a healthcare management program, health policy, and the social and behavioral sciences. Those are the main academic areas of study. And then students are allowed to tailor their education in ways that fit their career and educational goals by adding on concentrations. We do global health a little differently at Yale than some other schools, and that global health is a concentration that can be added on to any of these academic departments through the use of your electives is how you do that. We also have a concentration in public health modeling. We have a concentration in climate change. We just rolled out last year a very popular US health and justice concentration, and we have a track in regulatory affairs and maternal and child health. And again, these sort of concentrations or tracks, not sort of, these concentrations and tracks are added on or enabled through the use of your electives. The typical 2-year MPH student with us has 6 to 9 electives over the course of their program. So they can have a concentration or a track, or you can take courses at any of the other professional and graduate schools at Yale University through the use of those electives. That's a really great way to experience teaching and learning going on at Yale and to sort of broaden the relationships that you have. We also offer an accelerated version of our MPH2 people with work experience. We have an advanced professional MPH program.
好，那他也没有在万班里边啊。
We have an advanced, I'm sorry about that. We have an advanced, I don't know who it is, but it wasn't me. We have an advanced professional program that is an 11-month program for people with advanced degrees or substantial years of relevant work experience. And just this year, we rolled out an executive MPH, which is an online hybrid program in public health for people, again, with, and mainly geared towards professionals working currently. We have an MS, as I mentioned earlier, and a PhD. The MS programs are 1 to 2 years. The PhD is a 5-year program and is fully funded. We experienced this year our largest class ever in the MPH program. We just enrolled 402 students. The total MPH population, as you can see, is 595 students. Our MS program is 70, and our PhD total 95 students. We also accept applications for the MPH through SOFAS with a deadline of December 15th. We utilize a rolling process of admissions, and the things that we would sort of tell you are different about us, that we work hard at having our students experience during their time with us, is our integrated curriculum throughout Yale University. Many of the departments and the concentrations include coursework that is taught throughout Yale. We do have several joint degree programs throughout the university as well. We have 2 with the School of Management, the law school. We have 1 at medicine, forestry, international relations, the physician's associate, nursing. I could go on and on. Again, these are things to reach out to me later about or in the question and answer session for Yale. We are continually working to foster strong relationships with faculty in our community. This most often happens because of the small student population that we have. And again, what's different, our approach to global health is it can be integrated into any of the academic departments. So any one of our students that wants to have a focus in global health, in addition to some of the new concentrations we have, can do so. And we're most proud of our community that really fosters a sense of community, collaboration, mentoring, and involvement with, as I've mentioned a few times now, all of Yale, but we're very close with our alumni. The resources that we offer our students here at Public Health include career development, an important piece of wherever you go to school, because we know the transition from the classroom to working is important, and we want to give you all the tools we can to get there. I hope you will take a look at our website. We have a whole list of virtual presentations that we'll be doing over the next few months while the admissions process goes on. And hopefully in the spring, we'd encourage you, we'll hopefully be able to have in-person visitors again. We can't right now, but for any of you that would like to visit campus, we'd love to see you. If not, we hope to see you in one of our virtual presentations coming up this fall. Thank you.
Thank you so much, Mary. And thank you to all of our presenters today. I will share my screen and show you all how to ask questions in the chat. Again, just as a reminder, if you could just ask general questions during this part of the presentation and keep your specific questions for the breakout rooms. And we ask that all of our presenters turn on their video if possible. And I will stop sharing my screen. And going to
Nick, I think you.
Yep, I'm turning. I just turned yours on.
Thanks.
And yep. And Joni, I think I did the same too.
I'm trying.
Oh, here we go. Let me. All right. Well, while we get this all figured out, if anyone has any questions, feel free to put them in the chat. For the first question, what is one piece of advice, and we'll go through everybody, that you would give to a future graduate student? Just one piece of advice that you wish you would have known, or that you would give to a future graduate student. And we'll start with our first presenter, Boston University.
That's a great question. One of the things that I have seen is there are fantastic graduate programs across the country and across the globe. And as a graduate student, it's very important that you find the place that is right for you. And it's not to say that one program is better than the other. It's just about what's the right fit for you. What are you looking for? What are you passionate about? And what aligns with your interests? And so I would just recommend do your research. That's really going to be where you're going to kind of make that decision. And lastly, I would just say, as a future graduate student, it's really, really important that you are really thinking about what is the impact you want to have in the world or with your degree, and really showcase that in your application. I know for BUSPH, that's one thing that we truly look for. We are looking for people who will not only leave our program with a degree, but are really going to make an impact in the world. And so that's what we hope to see. And those are just some things to consider as you're considering your graduate.
Thank you. University of North Texas.
Thank you. So that's a great, Boston just shared a great piece of advice as well. And for me, one thing that I would like to recommend is make sure that as you are looking at these graduate programs in different institutions, that you really look at the learning environment. So you have some institutions that are a little bit larger, and so their classrooms, that student-teacher ratio might be a little bit larger, or the program format might be a little bit different. So, for working individuals, daytime classes during Monday through Friday doesn't really work for a lot of us. And then, so those types of programs might not be the best option. And again, it doesn't mean that one program is better than the other. It just means that that format just with that institution doesn't work. So I always like to encourage students to look at the learning environments of the institution, look at the student-teacher ratio to see how much interaction or engagement you might actually have. For example, with our institution, we're a smaller school of public health. So our faculty get a lot of interaction with their students, like a lot. Like they send text messages and things. So they get a lot of time to spend and interact and know them, not just on the academic level, but on a more personal level as well. So always look at the environment, the learning environment at different institutions.
Great. GW?
These are some difficult answers to follow. I think two pieces of advice, and one would be sort of generally that going into a master's program, even before you start the application process, to know that this is really what you want to do with your future, and this is really what you want to study. I think a lot of students, especially out of undergrad, are like, well, I'm going to go get my master's, like that's what I'm supposed to do. I think for advice in general, to make sure that this is the field that you want to do and want to go into. I think for general or more specific to GW advice is to do your research on the programs and the concentrations that we offer, to reach out to us, to reach out to faculty members, to reach out to students, to make sure you really have a great understanding of the program, and not only what you want to get out of it, but also what you want to give back to it as well.
Thanks. St. Catherine?
I would suggest that no matter which program that you choose, that you really look and investigate what the faculty interests are. Because public health is such a large field, you'll find that that faculty interest will become a lens into what their curriculum represents, as well as their research, especially if you're interested in participating in any research with a faculty member. So you'll have a great idea of what type of presenters they're going to bring into the campus, so that you'll really know what areas that you're interested in, because you may consider public health one option and then get exposed to a completely different avenue, whether it be environmental health or whether you're looking at population data, just simply through the faculty passion as well as what they're introducing in the class.
Great, thank you. Stony Brook?
That was definitely my answer, Elle. I had it all ready, so you took the words right out of my mouth. come up with something else. I think going into graduate school, if we're talking a lot about application and picking schools, thinking about once you're in school, to obviously make the most of the time, but more importantly, be kind to yourself. I think a lot of you that are coming right out of undergrad have gone through school during a very trying time to be in education and thinking about continuing education right now. Everyone's coming off of, coming out of this pandemic, coming out of this time, and we're all very, exhausted and leaning on each other, and look for the support is what I'm going to say, because so many students we're talking to are looking for additional support, and they've never had to ask for support before, but it's a different time that we're in now. So just be kind to yourself as you go through the process, and then once you're in school.
Thank you, Joni. University of Texas Health Science Center at Houston.
Yeah, I think if you're going into grad school, understanding where you currently stand, right? Financially, mentally, physically, emotionally. And, we consider full-time being 9 credit hours. Most students that are coming straight out of undergrad, they're used to 12 or 15 credit hours. Many of our programs, or many programs across the country, offer part-time and full-time. Understanding how many credit hours would be best for you to enroll in a particular term, so that you're ensure that you're successful. Sometimes trying to rush through the program is not the best. In particular, when you're looking at grad school, you're looking at more specialization. And so you want to be able to grasp the content and the theory that you're learning in the classroom. So I would just say, as you're enrolling in courses after you've been admitted, just be cognizant on how many credit hours you would like to take that you can handle each term.
Great. And last but not least, Yale.
I was, can you hear me okay? Sorry about that. I'm so involved in all of your answers. I'm so inspired by my colleagues here. I really don't have a lot to add to that after that. I would second a couple of things. And I think, in looking at sort of the presentations we all just did, you can see there's so many different degree types, and there's so many different academic departments, and et cetera, and that gets confusing for applicants. So sort of capitalizing on GW, I think starting to do your research into what kind of work you want to do with the degree once you get out, the impact you want to make. I mean, you're hearing a lot of the same words that you're using. Will help you as an applicant. It will help you make you a better applicant, but it will also make your time in our classrooms, I think, more valuable to you too, is understanding the possibilities in public health that you can achieve using either your MPH or your MS or your PhD. And so, any kind of, Anthony Fauci, I mean, all the people on the media today, even just looking into their backgrounds and finding out what credentials they have. And, I think the part about looking, about taking care of ourselves and taking care of our students, that was why I also brought up sort of the resources, and I think looking into that the different schools offer while you are a student in their community to help you get through the program. And we feel very strongly that once we admit you, that is our commitment to you, that you're going to get through. And so in order to make sure that happens, for instance, my office is right next to our wellness director. A long line of students every day going in and out, given the world that we're coming out of now. So I think understanding the degree you want, and then understanding which of the schools can deliver on that is my best advice for you.
Thanks, Mary. Next question is, due to the pandemic, some people haven't been able to get the experience, and they're worried that may hinder them from going into any of your programs. I know for some of you, experience isn't necessary, but those of you where experience is looked at, how do you overcome that lack of experience? And this goes to anybody.
I think it depends what you would define as experience. I think looking at being able to volunteer, buying those opportunities to be able to volunteer adds to your resume and to your application. Or research experience, I mean, that's not required for UTHealth. It's definitely encouraged. So if you do have that experience, that's great. But I think Looking at volunteer opportunities, it's something that you really want to get into at this point in time. In particular with the pandemic going on, there's so many volunteer opportunities that are out there, whether it's remote for safety reasons or even physically in different locations. So that's something to look into in your specific locations.
Thanks, Elvis. Anybody else? Okay, we'll move on to the next one. If you're interested in multiple concentrations or you're not quite sure where you want to go, do we have any advice for people who are kind of overwhelmed by the amount of possibilities in public health?
I'll start. At Stony Brook, we don't require students to select a concentration at the point of application. We used to require that, but then we actually did away with that a few years ago at the request of our admissions committee and our recruitment committee. We thought we wanted to give students an opportunity to explore a little bit in their first semester with us. So students are not required to pick that upon admission. Even our dual degrees, several of them that are not joined with a clinical license degree can be selected after the first semester. So we do give that flexibility. I know not every institution is able to do that depending on the way the curriculum is structured, but in terms of looking, that might be a consideration you take when looking at programs, is if there is flexibility. And everyone is stressed that you do your research now, take a look at what faculty you're doing, take a look at people that you would like to emulate at some point, careers that you would like to be looking forward to, and take a look at what their backgrounds have been. And in a lot of ways, all of the core knowledge areas, everything that an MPH or a degree similar is supposed to give you, we're going to give you no matter what concentration you pick, no matter what dual degree you pick, because it's what our foundation is on. So it's kind of like you can't lose. And then if you can narrow it down even further, you do that, but you might be able to have that flexibility in your first semester.
I wouldn't go ahead, Tricia.
Okay, sorry. I would say that we do require students to select a concentration, but that there are opportunities to change. And like I mentioned, our concentration or the core of all of our MPH programs are the same. So there's some room for growth. But I know for our school and all of the schools here, we have students and faculty and staff who are available. So if you're looking at schools to make those meetings, to attend those virtual events and ask the questions that you're asking here to all of the specific schools or during the next hour, but that, asking the questions and finding the information, I think is really important. It should be less overwhelming once you have some conversations, I would hope.
Can I jump in, Nick?
Sure can.
The other thing I would suggest, and I'm sure for a lot of the schools it's the same, and we do require you to apply to an academic department that guides the bulk of your study with us. The electives will give you opportunity to follow coursework in other departments, but the curriculum for all of the programs are listed online, and the competencies. What are the skills I'm going to have when I graduate from this program with this degree in health policy, say? And I think, and then looking at the faculty, as somebody else said, I think starting to understand, how am I going to spend the bulk of my days? What am I going to study? What are the options in the faculty, just in terms of the possibilities of what I can do with the degree? And then, the hardcore facts. What can I do when I get out? What are the competencies I should have when I graduate? I think those are also ways to zero into the department you're applying for. For us, the review of your application will be based on your department. So it is important. Whether or not you get in will be based on your fit with the academic department you select as your primary interest area. Thanks.
And I'll just add one little piece, one other piece of insight. And as you heard today, a lot of us have a lot of some of the same things. We've had some of the same verbiage, some of the same vocabulary, because there's a lot of commonality across all of our programs. But one thing I will say is ditto to everything everybody else said, but also, one of the best and oldest forms of marketing, if you will, is word of mouth. And so I always tell students, yes, do everything everybody else said, engage with the faculty, do your research, but we all have some form of an ambassador program. We all have some students that are here that have volunteered to give their input, their insight, share their experience. And so they can often give you that real information that you're looking for on what it's like to be a student at our institutions. What's my time commitment? What's my study scheduling like? How much time do I spend in the library? Where's the closest Starbucks? All those types of pieces of information that might be helpful for you as a student. And so that can also help when you're looking at determining which concentration to pursue, because they can also give some insight into the curriculum. And so for like us here at North Texas at the Health Science Center, we allow students to change, but we really try to have that done in that first semester. After that first semester, if they want to change concentrations, and that gives you enough time to really get to know the faculty, the staff, the curriculum as well, but really to also engage with those second year students and really know what's really coming up your down your avenue if you're going to stick with that particular area.
Thank you so much. Those are fantastic responses. And I know I didn't get to everyone's questions, but feel free to join the breakout rooms. You'll have an hour to bounce around between all the breakout rooms. But first, let me just share my screen real quick and just show you some upcoming events, some other information, and then we'll open up the breakout rooms. And can you all see my PowerPoint? Yeah, okay, great. All right, so these are upcoming events. I apologize if the font is small, but we have one on the 7th, the 19th, and the 21st. If you're interested in coming to any future events, go to thisispublichealth.org/events. Share this information with your friends. This is a great way to hear from a lot of different perspectives and be able to bounce around and ask your specific questions. Also, you could follow us on social media. We always post our events and more information about what is public health and the different concentrations. One of our biggest things is our ambassadors. We have ambassadors that represent our schools from around the world, and they're able to fine tune what exactly public health is if you're starting to try to figure out what is the field and what is the different concentrations. Also, we have 3 resources. If you're struggling to figure out how you're going to pay for grad school, make sure to visit our Finance Your Degree website. We have the Academic Program Finder, where you can search for specific things and it'll show you which programs are accepting applications. And then we also have the Public Health Graduate School Viewbook. All right, so we will now open up the breakout rooms. You can self-select your own breakout room. We're now going to give a little bit of time to our presenters, but for our guests today, our attendees, you can self-select your own breakout room. If you are having trouble selecting a breakout room, we can put you in one. But just give us a few minutes for everyone to get in their room. Once we place you in a room, you will get a pop-up that says join. Make sure to click join, but you can also just self-select. So feel free to bounce around. If you see a busy breakout room, go to another one. You do have an hour to explore and ask questions. So thank you all for attending today. We hope you found this informative, and we look forward to you attending a future event. Take care.